Right now at 5, shocking. That is how one Milwaukee alderman describes a newly released report on the city's lead poisoning prevention program.
That report from the state cites repeated failures and mismanagement by the city in handling cases of lead poisoning in children.
It's the latest development in a story that first came to light back in January. That is when Mayor Tom Barrett announced thousands of families were left in the dark. They may not have received proper notification about high levels of lead in their children's blood. That same day, Barrett announced Milwaukee Health Commissioner Bevan Baker had resigned.
Now, later that month, the health department released a 50-page report detailing some of its lead prevention failures. We also learned that 2 children had been sent back to a home that was unsafe for lead exposure.
Pete Servakis has seen this new report from the state. He's been getting reaction to it. Joins us now with that. Pete?
Well, Steve, here is that report. It's from the Department of Health Services, which validated some of the old concerns about how Milwaukee has been handling those lead levels and raised some new ones. Alderman Michael Murphy says the Milwaukee Health Department dropped the ball on helping children with dangerous levels of lead in their blood.
It's shocking. It should not have occurred.
In this 14-page report, the Wisconsin Department of Health Services says it found insufficient documentation and record keeping at Milwaukee's childhood lead poisoning prevention program and alleges the health department did not comply with state statutes. DHS reviewed 108 cases from a 6-year period. Some of those cases, often traced to lead paint or lead service lines, were eventually declared closed. But DHS found that children in 91% of those closed cases did not meet the state standard minimum blood lead level for closure. Murphy wants answers.
First question I would like to ask and get an answer to is how could you have allowed that to occur?
And according to the report, failure to follow the state's guidelines failed 12 kids. These children, beginning around June 1st, 2016, were no longer being provided the environmental investigations and public health nurse case management required for a child with an identified elevated blood lead level.
How as a city do we move forward and make sure this doesn't happen again?
Well, it's an obligation of both the mayor and the council to make sure that they don't make these same mistakes.
The DHS report called on the city's health department to produce a comprehensive correction plan to the state by the end of June.
Pete, thanks. Mayor Tom Barrett had this to say in response to the report. Quote, this report came to the same conclusions we came to last year, that there are significant issues that need prompt attention. That's why we've invested so much effort in corrective action and continue to prioritize the health of children in Milwaukee to make sure we're doing everything that is appropriate. Again, that's Mayor Tom Barrett today.